Dani, perhaps let's expand that upon you, because your work is how the microbiome has an effect on birth. Depending on the method of birth, there's a number of microbiome interplay, and we really want to educate women about the types of birthing experiences that you can have and what that means for the microbiome.
I think it's a really important point. The most common exposure that I have to women asking me questions about the microbiome is around mode of delivery. So, I mean, I think what Matt said is that diet does have an impact. We've got research that says if you've got a high-fat diet when you're pregnant, that you change the gut microbiota for your babies, at least for the first 6 weeks of their life and probably into the future, which then sets up what we're talking about is a lifelong inflammation potential to chronic disease. So that's one aspect of it. But the question I get asked is, if I have a cesarean section, am I doing something bad? Or if I need a cesarean section, is there anything that I can do to help my baby get the bacteria that they would have had if they were born vaginally? So when you hold the paradigm as an obstetrician to talk to women about this, it's very difficult because being a mum is filled with guilt, right? You're just guilt-ridden from conception until they're 18 or until you die, probably. It's probably a lifelong process of parenting. And there's a lot of pressure on women to do it a certain way, a good way, and there's a lot of societal impacts that kind of make their decision-making process even more challenging. So what I like to say to women is it's definitely different. So if you're born vaginally, we're aiming for hopefully a head first baby, sometimes a bottom first baby, to come through the vaginal canal. We know that the vagina is full of the good bacteria that we've been talking about, lactobacillus species that are trying to inoculate or transfer to the baby through the passage of the vagina. The baby's ideal position for birth is to face the floor. Okay, so facing the rectum of the mum to pass through what is likely a passage of poo. Every woman is terrified of passing poo when they have their baby, and it's like that's a good thing. There's a natural process and there's a mechanism that is involved in that is clearly there for a reason. So the baby's birth passage, if it's vaginal, is supposed to come into contact with vaginal microbes and our gut microbes, and then the baby is inoculated with that. We know that babies that are born vaginally have a different microbiome in their mouth and in their tummies and in their guts to babies born via cesarean section. And if there's a medical reason to have a cesarean delivery, if it is the choice of the woman to have a cesarean delivery, then I think it's also important to tell them that it can change the baby's microbiome, but there's research being done to try and see whether we can help shift those changes that happen as well. So I know a lot of Stephen's work will touch on to what we can do from that point onwards. But yes, it is true that if your first exposures to the world are in an operating theatre with sterile surgeon and sterile surgical gloves, having been given antibiotics, that those babies come out, that they look different. Their bugs in the stool looks different. They look different probably until the age of about 6 months. And what we don't know yet is what impact that has long term. I mean, I guess there's another trending topic around vaginal seeding, and that's quite controversial. So it's saying if I want to have a cesarean delivery, is there a way of me passing the different bacteria and microbiota from our vagina or from the mum's vagina to that baby after the birth of the baby? And there's lots of research to say that that's potentially beneficial. We haven't adopted that wholeheartedly in Australia at this point because it's still in that exploratory, experimental phase. But I guess it's another way of us saying that there are things we're trying to do so that if we have to go down the pathway of a cesarean delivery for maternal request or because it's medically indicated, that there are things we can do to help that baby to gain the microbes that we have co-evolved with and that we need in order to be healthy individuals.